Welcome everybody, with you Dr. Magdy Abdel, consultant of infectious disease, hepatology, and gastroenterology. Our topic today about sex-transmitted diseases and oral sex. So, we have to answer this question. Sex-transmitted disease can transferred from oral sex? Yes. Many sex-transmitted disease can spread from oral sex. As regard this infection, so we will discuss today about methods of transmissions. Many sex-transmitted disease and other infections are spread through oral sex. Anyone exposed to an infected partner can get an sex-transmitted disease in the mouth, throat, genitals, or rectum. The risk of getting an sex-transmitted disease or spreading an sex-transmitted disease to others through oral sex depends on several things, including the particular sex-transmitted disease, type of sex, and the number of sex acts performed. It is possible to get some sex-transmitted disease in the mouth or throat after giving oral sex to a partner who has genital or anal or rectal sex-transmitted disease. It is possible to get certain sex-transmitted disease on the genitals and the genital areas after receiving oral sex from a partner. With mouth or throat infection, it is possible to have an sex-transmitted disease in more than one area at the same time. For example, you can have an sex-transmitted disease in the throat and the genitals. Several sex-transmitted diseases like syphilis, gonorrhea, and intestinal infections that are transmitted by oral sex can spread in the body. Oral sex involving the anus can transmit hepatitis A and B. It also can transmit intestinal parasites like Giardia and bacteria like E. coli and Shigella. If you have an sex-transmitted disease, you might not know it because many sex-transmitted diseases are symptomless. It is possible to spread sex-transmitted disease even when you do not have any signs or symptoms. Which sex-transmitted disease can be passed on from oral sex? So, many of them, like chlamydia, gonorrhea, syphilis, herpes, human papilloma virus, HIV, trichomoniasis, chlamydia trachomatis. Risk of infection from oral sex. Giving oral sex to a partner with infected penis can cause chlamydia in the throat. Giving oral sex to a partner with infected vagina or urinary tract may cause chlamydia in the throat. Giving oral sex to a partner with infected rectum might cause chlamydia in the throat. Getting oral sex on the penis from a partner with chlamydia in the throat can cause chlamydia of the penis. Getting oral sex on the vagina from a partner with a chlamydia in the throat might cause chlamydia of the vagina or urinary tract. Getting oral sex on the anus from a partner with chlamydia in the throat might cause chlamydia in the rectum. So we will discuss areas of initial infection like throat, genitals, urinary tract, rectum. Initial signs and symptoms of infections like most chlamydia infections in the throat have no symptoms. When symptoms are present, they can include sore throat. Many genital, urinary tract, or rectal chlamydia infection have no symptoms. When symptoms are present, they can include discharge from vagina or penis. Discharge from vagina may be bloody. Burning feeling when being painful or swollen testicles, rectal pain, or discharge. Treatment. The right medicine can cure chlamydia. Sex partners of a person with chlamydia should also receive testing to ensure there is no infection. People with chlamydia should not have sex until 7 days after they and their sex partners receive and to complete treatment. If left untreated, throat infections can spread to sex partners who do not have the infection. Often, by performing oral sex on a male partner penis, if left untreated, genitals, urinary tract, or rectal infection or uh, can spread to uninfected sex partners. In women, can cause pelvic inflammatory disease, which can lead to chronic pelvic pain, infertility, and ectopic pregnancy. A pregnancy in the fallopian tube or outside of the womb in pregnant people might result in premature birth or low birth weight in babies. Can spread to the baby during delivery and cause infection in the eyes or respiratory tracts. In men, can cause epididymitis, a painful condition of the ducts attached to the testicles that may lead to ductal scarring. In everyone, may increase risk of getting HIV infection, might increase risk of spreading HIV to sex partners, may cause reaction throughout the body known as reactive arthritis. This can lead to arthritis, joint pain. So, conjunctivitis or pink eye, a rash on the soles of the feet or elsewhere, not exactly is oral sex safer than vaginal or anal sex. It is difficult to compare the risks of getting specific sex transmitted disease from specific types of sexual activity. Most people who have oral sex also have vaginal or anal sex. Few studies look at the risks of getting sex transmitted disease other than HIV from giving oral sex on the vagina or anus compared to the penis. Studies show the risk of getting HIV from oral sex, uh, whether giving or receiving, with a partner who has the infection is much lower than the risk of getting HIV from anal or vaginal sex. This may not be true for other sex transmitted disease. So, getting HIV from oral sex may be extremely low. If you are having oral sex, you should protect yourself. So, thank you very much.